Welcome back to Talk of Alabama. You know, deciding to have a cosmetic procedure done can be an emotional and wonderful decision, but our next guest, that is, can walk us through it with ease. Dr. Melanie Petro with Petro Plastic Surgery and MedSpa joins us now. Good morning and welcome.
Thank you.
Thanks
Glad to be here.
So many wonderful things to talk about. I mean, where to begin? Tell me what you offer, and tell me about your office.
Well, we just moved across the street from where I was, so we're on Montgomery Highway, and we love our location. We have a great view, and it's really pretty. We've been able to make a lot of privacy for the spa patients and for the surgery patients by having more room. So we're happy to be in our new location, and with that has come lots of new things. We have all new lasers, which our favorite is the Cyton Halo, which I had done on Thursday. So it's amazing how fast your skin can heal and look better. It's one of the biggest advances that I've seen in my time in practicing, because it used to be that you were out of work and looked terrible for weeks. So
yeah, that's a big concern, I think, for many people.
It's a huge concern.
For people that aren't familiar with the Halo procedure, kind of, if you can break it down for me, what it exactly is.
Halo is a hybrid laser, so it combines ablative technology, which is what goes through your skin in order to make an injury so that you produce more collagen. Because when you're very young, you quit making collagen.
Yeah.
And then we got to stimulate the skin to make more.
So it's for your face and your neck.
You can do face, neck, chest. A lot of people are doing their hands now.
Okay.
Because you don't want to have a young face
and old hands,
so
right?
we can do hands, we can do legs, we can do all parts of the body. It treats pores, fine lines, pigment, sunspots.
So that's a great procedure where some people are worried about going under the knife to have something done to keep that youthful glow. So this is an alternative to that.
And there are a lot of alternatives now. Another one, Voluma, we're actually having an event with demonstrations tomorrow night at our office. But Voluma, you can put it in the cheeks, and people refer to it as a liquid facelift.
Oh.
So there's a way to make your cheeks look fuller, and when your cheeks look fuller, it gives you a lift through your face. So there are a lot of options, because there are people that are about to get married, or their kids are getting married and they want a lift, but they don't want the downtime. So there's all kinds of options for people to try.
Very nice. Now talk about the event tomorrow night. It's at your office.
It's at our office, and we'll have demonstrations we'll do some Voluma. It's all about volume. They say you want to be skinny everywhere else, but have fat cheeks, and that's a sign of youth. So we'll be doing some demonstrations and door prizes.
How do people, can people just show up, or do they have to sign up beforehand?
They can just show up.
Really? Okay, very nice. So is there anything in particular that you specialize in?
The face. I love
everything
the face.
with the
It's
face.
my favorite.
Okay. What are some of the other things that people what are the most popular, I guess I should say, procedures that people are looking to get right now?
Usually the injectables, whether it be Voluma or Botox, things that treat the lines. The laser procedures are more popular in the winter, but now we do a good bit in the summer as well. And then the facelifts. They're all gradations. It's like as time has gone on, they've gotten less and less and less invasive, so that you can have a mini lift, or what we call a Petro Petite lift, and you can be back with makeup on in a few days. So the amount of downtime that used to be 2 weeks of bruising and all those things have gotten so much better. We have lasers that treat the bruising now too. So
now, very quickly, we mentioned it earlier when I was first introducing you, but having work done can be an emotional thing for people, because I think that I would say just about almost every woman wants to have something done to maintain that youthful look, but actually beginning the process of doing it, it can be, a difficult decision to make.
It can be, and that's one thing I am different. I understand that. I'm a woman, I've had a baby, I know what it's like to look in the mirror and not be comfortable with who you are and how things change. And that's very common for women. So our office is very spa-like. It's more of a boutique than what you would expect. And I have people come in, and I ask them what bothers them, and we spend a lot of time. I do, the estheticians do, we all spend a lot of time with patients. And it can be emotional. I mean, there are patients, especially in the summer, they've had their ears done, and they'll, just come in tears in a happy way, because they haven't worn a bathing suit, they haven't put their hair up, because little girls can be mean.
Yeah.
So a lot of them have been teased so much that since the 5th and 6th grade, they've never worn their hair in a ponytail or gone swimming. So it can be emotional in a really good way too, people feeling like they're getting their life back and they're able to do things that maybe they couldn't do before.
And having some confidence that they maybe didn't have before.
Confidence. And usually it's about their sisters or other people in their family they more so than
Yeah.
you know, their husbands. So usually husbands aren't as into it as the women. The women, first person they usually see after a facelift is going to be their sister.
Right, exactly. Well, is there a website where people can find out more information?
Yes, it's petromd.com,
All
and we
right.
have a Facebook page as well.
All right, well, thanks so much for joining us today.
Thank you for having me.
All right, and I believe we are going to send it back over to Ebony in the kitchen. Yeah,